So this video is about surgery. People have surgery quite a bit of the time for orthopedic sort of musculoskeletal conditions, and a lot of people have a lot of faith in these surgeries that it'll be the answer to their problems. They may well have had physio and that hasn't worked, or injections and that hasn't worked, and then they're like, right, surgery. The reality is that surgery all that it's cracked up to be? Obviously with surgery there's a lot of risk, as in anesthetic, the risk from that, risk of basically dying. Obviously spinal surgery, there's a condition called failed back surgery syndrome, and I've known people who've been worse from spinal surgery rather than better, and all the rest of it. The reality is that there's not been until recently much in the way of research on trying to do placebo surgeries. And you probably think, well, how can you do a placebo surgery? Well, certain surgeries are very easy to do that way. For example, anything done arthroscopically, so anything which is therefore keyhole surgery. And they've done this in a few areas, one of which is the knee. The knee surgery they did is called a meniscectomy, an arthroscopic meniscectomy. This is something for meniscal tears, which is cartilage tears in the knee. And Premier League footballers have this quite a lot of the time. So they'll tear the cartilage and they'll basically have this surgery to get them back playing again. So they go in, keyhole, they trim up and smooth out the little bit of damaged cartilage, so they take a bit out, and then the cartilage is not irritating anything internally anymore. That's the plan. The reality is that you can actually get better without surgery for this type of issue in a lot of cases, and surgery is just the speedy, quick fix that someone's looking for. The problem is that by having the surgery, you are more likely to have arthritis in your knee. But if you're a Premier League player, it's probably not going to be till you've retired. So, and you may not even know that this is likely. But what's interesting is they did do this study where they did the real surgery, where they went in and did that. The other group, they basically went in and just nicked the skin. They didn't go inside, they nicked the skin as if they'd gone in, and it looked like they'd had surgery. And what they found is, which was very interesting, they found that the outcome was the same in both groups. So whether the people who had surgery and the people who didn't had the same positive improvement. The difference is one group didn't have, wouldn't have had the risk factors associated with the surgery, like the arthritis elements and things like that. But it just shows you that the surgery is quite placebo dominant. Basically, the more invasive, the riskier something is, the more placebo effect you'll tend to get from it. And surgery, therefore, would be very much that. They've done other ones in the shoulder. So they've done another arthroscopic surgery in the shoulder where they go in and they shave off a bit of bone on the acromion process. And the aim is to stop like impingement syndrome and things where you catch under that bone. And again, they found that this surgery, when done placebo versus real, had the same outcome and therefore is no better than a placebo. Not to mention the surgery's outcomes in a general sense aren't necessarily all they're cracked up to be either. And especially in a shoulder, you've got a lot of muscles that keep the shoulder moving properly, and pain and swelling and things will actually diminish them, which is exactly what surgery will bring. So it does seem like there is more evidence showing surgery, although yes, don't get me wrong, surgery sometimes is needed and is the right approach, but might be done too much, too willy-nilly, and people don't understand that that it may not be what they think it is. It might be more placebo driven, it might be more risky, there might be other elements that they haven't considered, and therefore it might not be the way to go. And they've, another one is ACLs, ACL reconstructions. Again, they found that whether you have surgery or not, you have rehab, so you've always got the rehab in there. I've seen a patient in the past who had the reconstruction done but didn't do the rehab. This was in the NHS, and he was still on crutches 2 years later. So you're like, how good's the surgery? Maybe not that good. Maybe it's more about the rehab. And there are NFL players and rugby players who play to this day at highest level of sport with no ACL, with no reconstruction. So they just rehabbed it. So you think to yourself, well, how good or important or beneficial is that surgery then? If rehab is the key, and you can get better with rehab without surgery, I'm not saying in every case, but in a lot of cases, then maybe that is the solution. So I think next time you're thinking of surgery, you need to make sure that it is the right approach. You get a few opinions on it. Maybe your rehabilitation hasn't been thorough enough, or been done by the right person, or it was the wrong problem. I mean, I've seen people who've had shoulder pain and have had physio on the shoulder, and they have had injections in the shoulder, they have a scan on the shoulder and they see something on the scan. Again, the incidental findings we know is pretty high on scans on normal people, and they have surgery and it doesn't work, and then lo and behold, they treat the neck and they get better. So they had surgery unnecessarily on the wrong problem, therefore it didn't work. They had physio before on the wrong problem, hence why it didn't work. So you've got to look at the bigger picture and work out, is it the right approach, and is this the solution for me? So have a good think about it next time if you are in this position, because it may well be that surgery might not be the right approach. So that's it from me today, and I'll see you next time.